today, the government of Saskatchewan and the Saskatchewan Health Authority have made the decision to send 6 of our ICU patients out to Ontario. This is being done to ensure that they continue to receive the very best possible care available. While the quality of care patients receive in Saskatchewan has been and it continues to be excellent, and that is thanks to our dedicated and professional healthcare workers here in the province, the current level of pressure that our ICU staff requires that a few patients be sent out of the province to relieve some of that current pressure that we have. We'll be working with the families on a case-by-case basis so that they can have 1, possibly 2 family members that will be able to join and support them as well to ensure that this, those family supporting folks are able to, be in the vicinity or be near their loved ones as we go through this. So to the family members, this ensures that everyone, including their family member, will receive the highest quality care, and we're going to work with them so that there can be family supports near them. We will also today be asking for additional resources from the federal government, staff that can work in our ICU settings. And while we appreciate any help that the federal government can provide, we're also quite realistic and that this will likely not be a large number of staff, but it will be a very specialized grouping of staff that will be required. Saskatchewan is going through a challenge right now. We have a number of communities across this province that have quite frankly, let's call it what it is, far too low of a vaccination rate. We're continuing to work through our Saskatchewan Health Authority, through community leaders, on how can we continue to increase that vaccination rate by working with individuals, making vaccines available, and yes, introducing a very ambitious proof of vaccination program so that, as I had said numerous times for months now, life is going to be more uncomfortable for the unvaccinated in Saskatchewan. It's unfortunate that is where we're at, but that is where we're at, and that's why we introduced the policy that we have. And it is increasing our vaccination rates. It needs to increase them even more, as that ultimately is going to be our path to lower hospitalization rates, which is guiding our decisions, always has and will continue to throughout this pandemic.